Welcome, welcome. I finally get to do a sit down with the charming and ever fun Brianna. Now this is a point of contention at supper. Brianna. Right, but people like to say it different ways, don't they?
Oh, a lot of people love the term Brianna. So fancy.
Brianna.
But no, I'm right here in Maine. It's always been Brianna.
Right. Brianna Henward, and she and her husband have a firm, and it is Tindon Health and Wealth.
Correct.
And you are the health.
I am the health.
Now tell me about the name Tindon. How'd you come up with Tindon if your name is Henward?
Absolutely. So Tindon is a combination of my mom and my dad's name, Tina and Dawn. So my mom was a stay-at-home mom, and she founded us 18 years ago.
Oh.
And about 6 years ago, me and my husband took it over. And I can't think of a better way to pay homage to that
Oh, that's sweet.
than to keep the name.
I love it.
Yeah.
And what is your husband's name?
My husband's name is Andrew.
And that you guys have 2 kids, 2 boys?
I have a 1.5-year-old boy, and then I'm the caretaker of my sister Bridget. So she's special needs. Yeah, so she has cerebral palsy, epilepsy, and autism. And so mentally, she's like 6. So it's like having 2 kids.
Right.
But she is where my real passion come in of this health topic. Because she went on Medicare at age 20. So we manage her Medicare plan, we manage her Maine care, and how all of that works. Like, it's not, the health piece isn't hypothetical for us. It's truly how we manage our family and take care of my sister.
Do you do, in the firm, do you do Medicare?
Yeah.
You sign people up to 65, I'm here to get my Medicare.
Absolutely. We do Medicare, we do Affordable Care Act.
Okay.
We do Medicaid. Like, if it's health related,
Okay.
I can help people with it.
Now, that's interesting because there are a couple of choices under the Medicare umbrella, right?
Absolutely.
And you have to help them strategize that.
Absolutely. No, we are very honest, and we're very proud of the fact that we can help you make whatever path is right for you, whether it's Medicare Advantage or it's Medicare Supplement. It doesn't really matter to me. I want what's best for my clients. And in Maine, the laws are a little bit different from other states. We have different regulations around Medicare supplements. Can you pick them up later? And we're very proud of the fact that we work with all the options. So I get to kind of be that unbiased resource for my clients, and we're a free resource. So there's no reason not to work with us.
Right, and you get them going on their Medicare or Obamacare, whatever it is, Medicaid, and then they have access to you year-round.
100%. Like, and because things change. One plan might make sense for you this year, but the next year it could be totally different because maybe the plan has changed, or maybe your needs have changed.
I was just wondering, what's your typical day on the job then, if you have a 1.5-year-old?
Absolutely. So a typical day is definitely, I do a lot over Zoom. I do a lot of going to people's clients' house. But yeah, I get up, I see my beautiful boy, I get him off to his program, I get my sister off to her day program that she adores. And then me and my husband just get to go out into the community. I do a ton of educational events. We do Medicare events, prescription events. My background is culinary, so I also go to senior centers and we do cooking classes and we do Air Fryer 101. The whole point at Tindon is we want to be that pillar of the community. We want to be there for people on their best and their worst days. So, and we truly believe that if you have these different pillars of your life set up, you have your physical wellness, you have your financial wellness, and you have your social and community wellness, your life, whether it's in retirement or it's before, will thrive.
I was wondering, what is it that you tell every person that you meet with?
I think that in retirement, you need to have your team. You need to have your health advisor, you need to have your wealth advisor, and you need to have like your law and your CPA. You need to build that team early in retirement so that way when things crop up that you don't need answers to, you're not floundering. Things can happen quickly and fast. So
I feel like a lot of people are worried about things, especially pre-retirement. Can I retire? I hear a lot of people saying, I can never retire. And maybe that's not true.
Not true at all. I see a ridiculous amount of people delay retirement due to health insurance. 27% of people age 55 and older delay because they either don't understand Medicare, they don't understand that if they're under 65, there are health insurance options for them that's not through their employer. I had a gentleman, he was 70, and he had planned to work till 75 because his wife was 10 years younger. So his plan was, I have to work till she's 65, but he doesn't have to. We sat down with him, we showed him all the different options, and he was like, oh my gosh, I would have retired last year. And so now he's retired, she has health insurance, he's on Medicare, and they get to retire on their time, not some magical number of 65.
Right, and I feel like there's a lot of longevity in Maine.
100%.
People do work till 70 if they want to, or 75 if they own a business and beyond.
Absolutely, if they want to, awesome. Like, I absolutely think that when you hit 65, you need to compare your options. You get to look at it and say, this is my employer coverage, and this is my Medicare option. Let's see which is better and which is cheaper. So many people stay on their group coverage because they don't understand Medicare, not because Medicare is more expensive or Medicare isn't as strong. You pay into Medicare your whole life. So let's learn about it, and if it's stronger coverage than your employer, you can keep working, but let's get you onto the coverage that you paid into and you earned.
Now that's a very interesting point. That is a very interesting point. I bet putting all these pieces of the puzzle together is what you enjoy every day.
I absolutely love it. I think it is, there's so many different parts to it, and it's so interesting, and I get to go out there and just be an educator. Like, let's put your current plan side by side on the table with some Medicare options or some Affordable Care Act options, and then we can decide completely based on the data and make that choice. I geek out about it.
I was wondering if sometimes maybe folks meet with you and they think, well, you're so young, how do you know?
Absolutely, no, I totally.
Do you get that?
Every now and again, so I have a couple of things in my corner. One, I'm managing my sister's plan, so I'm actually hands-on with a Medicare plan at age 30. Very fortunate. My mom's been doing this 18 years, so I've grown up right beside this. And I've had a very fortunate that I love using my different networks. I'm a Cornell graduate, I know how to study, and this is my passion.
Well, I think you're super smart. After dining with you and spending some time with you, I would come to you. You're Medicare specialist, and your firm, Tindon Health and Wealth. Thank you, Brianna.
Thank you.